Let's talk about skin grafts. So skin grafts are a great reconstructive technique to achieve wound closure when the wounds are amenable for skin grafting. If there is exposed hardware or exposed bone or other vital structures, skin grafting is probably not the best reconstructive option. I will probably perform some other type of flap reconstruction to reconstruct those wounds and defects. If the wound is rather simple and has a healthy wound bed that is amenable to skin grafting, then we can perform a skin graft. So skin grafts come in two basic forms. There are full thickness skin grafts and split thickness skin grafts. The advantage of full thickness skin grafts is that over time they tend to look a little bit better and perform a little bit better. The major downsides to full thickness skin grafts is that we create a full thickness wound wherever we harvest the skin graft, and full thickness skin grafts have a decreased likelihood of surviving. In other words, there is a higher percentage that the skin graft will not work when it is a full thickness skin graft. So full thickness skin grafts are generally reserved for wounds on the face and hands and other critical areas that are relatively small. Because wherever we remove the skin graft from, in other words, the harvest or donor site, needs to be able to be sewn shut, otherwise we just created another wound. Split thickness skin grafts, on the other hand, are the most common type of skin graft used for a couple reasons. A split thickness skin graft can be harvested from the thigh or really anywhere. Usually we harvest them from the thigh, and they don't leave behind another defect, meaning there's enough skin left behind on the thigh to heal on its own. A split thickness skin graft can then be placed over the wound, and it has a higher likelihood of surviving compared to a full thickness skin graft because it is thinner. The thinner the skin graft, the more likely it is to survive transfer and take and survive on the recipient wound bed. So in general, split thickness skin grafts are the most common skin graft we perform in the reconstructive world. If it is a more complicated or sensitive area, such as the face or the hands, that is when we would be more likely to perform a full thickness skin graft. Another time we often perform full thickness skin grafts is in reconstructive breast surgery and gynecomastia surgery, where we utilize the entire thickness of the skin to reconstruct some of those defects. Split thickness skin grafts leave a donor site that is like a road rash. So it will leave a nasty scar where we take it from, and it looks like road rash or a scraped area once the a split thickness skin graft is harvested. The area will heal on its own, but it will heal with a scar. So we normally place these split thickness skin graft donor sites on the thighs where people don't really care if they have an ugly scar on their thighs. A full thickness skin graft leaves behind a linear scar where the wound was primarily closed after the full thickness skin graft was harvested. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.